Welcome to Podcast 83, a regular look at the news, stories, and trends related to Michigan's 83 counties from the Michigan Association of Counties.
Hi, everyone. Welcome back to Podcast 83, the podcast put on by the Michigan Association of Counties. I am Deena Bosworth, Director of Governmental Affairs. And today I'm joined by Samantha Gibson and Jimmy Johnson from our staff, and also a special guest today. We have State Representative Matthew Bierlein, former County Commissioner from Tuscola County, former MAC Board President, and now second term state legislator. So welcome to our podcast.
Thank you very much for having me.
Yeah. Are you going to do the plug? Come on. Let me see the mug.
Well, I have my county, my county's 83 coffee cup here. Been using it all day. I've been on office hours.
Perfect. And yesterday out on the lake, I saw you with your 83 hat on.
That's true. That's true. I try not to forget where I came from. So
that's true. And we can tell and we appreciate it. So thank you very much. So we're going to just ask you a couple questions today. You know, we see that these budget negotiations are back and forth and back and forth. You know, the Senate passed out a budget that really the numbers aren't going to add up in order to do everything that the Senate has passed out. And I know the House is working on it, but what do you think the delay is? What do you think, what's going on right now? What do you think?
So I think that from the House perspective, I think Chair Bierlein and her subcommittee chairs are really trying to be deliberate about the actual dollars. I think the way that they've approached this is the state budget has ballooned so much over the last 6 years that there has to be room to decrease some of this, whether that's through positions that were approved that were never filled. And do we continue to reallocate those funds every year if we're never filling those positions, or if it's, discretionary spending, whatever it is, there's only a finite number of resources. If we want to put money into schools, if we want to put money into roads, the taxpayers of Michigan have been pretty vocal that they think they pay enough in taxes. So we need to find that money from somewhere else. And I think I wouldn't say it's a delay. I think that's the current process and why it's taken the time it has from the House side.
That makes sense. That absolutely makes sense, because we are really concerned about, what's going to happen to some of the line items that come through that counties rely on, like our revenue sharing. There's been money, requests for additional prosecutor funding. I mean, the list is long. So we do worry about, kind of where that money's going to come from, if it's going to be there. So thank you for that. I mean, they did say statutory deadline says get the budget done by July 1st. Well, that's tomorrow.
That's tomorrow. Is the whole budget going to be done tomorrow? No. I'll say no. Constitutionally, it's by our fiscal year, which is September 30th. Have it done by October 1st. I don't think that's unreasonable. We want to get that done. I think the governor wants to get that done. I think there are senators that want to get that done. No one wants to be the person who instituted the first government shutdown in 15, 20 years. I don't remember the last one because I probably wasn't really paying attention to state politics at that point in my life.
I remember being locked in that chamber trying to get that budget done. It wasn't pretty.
I bet we were really broke during that time, though. I don't think we had $83 billion to spend when that happened. And so there's no reason for us to go into a shutdown. People are just going to have to come together to make some common decisions that are good for the state. And if ever there was an opportunity to do that and say that it was done in a bipartisan manner and that it should have pieces that everybody likes and everybody dislikes, this should be a time to do that with a split chambers and a governor who really seems to be wanting to be very much in the middle right now, as maybe she has some national aspirations or doesn't. She seems to be someone who wants to work towards some solutions right now.
That's awesome. That's great news to hear. It really is. It really is. So let's jump to a couple of different items. And I know, Jimmy, this is, some stuff that's important to you, and Sam, important to you. Tomorrow you're going to have a hearing in your oversight subcommittee on the psychiatric bed shortage. What made you want to bring that up?
Well, so actually it's the maybe the fourth or fifth committee hearing that we've had on this particular issue. And as you guys know, I was county commissioner in Tuscola County. County seat is Caro. We have the Caro Center State Psychiatric Facility there. And that's been part of our community for over 100 years. The community is very accepting of it. It's a large employer in the district. It brings a lot of value, as well as it's just become part of the community. It's something that, our people work there. They believe in what's happening. They want to take care of these people that have that need. When I was still a commissioner, there was talks of closing the facility. So this is well over 6 years ago. And we started advocating very heavily at the state level with our rep and our senator at the time, and then with the department, to advocate for a new hospital to be built in Caro. We recognize that we need those beds. There had been a major disinvestment from state hospital beds over the previous 20 years. And we thought we were a great place to do that. And we convinced all the stakeholders that that was the right decision. And I want to say they were going to build a 300 bed unit, brand new, state of the art, in that location. And when the administration changed just a year later, that was one of the first things on the chopping block from DHHS, was that new hospital. So we had to start the process over, advocate again for why Caro was the right place, advocate for the importance of state psychiatric beds as part of this process. And eventually we did get a new 150 unit bed. So we actually lost beds for what was currently there, or previously there, and then what was promised to be built. We lost beds, and they haven't been replaced somewhere else. So the state just has less beds than it did. So that always kind of left a bad taste in my mouth, and I thought we were missing the boat on what we should be doing. Then again, going back to, being a county commissioner, and what do you hear when you have meetings with the sheriff and you're talking about bed capacity in your jail and things like that? It's between 20 and 30% of the inmates in your jail are receiving some sort of mental health services, or should be probably in a facility for mental health services and not in the county jail. Like, that's just not the place for those people. So as we got our assignments this year, and I was given the opportunity to chair the oversight committee on public health, one of the things right away that I knew I wanted to jump into was this bed shortage, or what appeared to be a bed shortage. So we started asking questions, started looking around, doing some research, and what became really evident really fast is that Michigan really trails the nation in the number of available beds. Michigan has about 5 psychiatric beds per 100,000 people. The national average is around 30 beds per 100,000 people, and the gold standard is like 50. And so this is a big discrepancy. From the state's perspective, I mean, DHHS did come in and testify. They don't believe we have a bed shortage because they believe that it's the type of beds being provided to the type of people, that the people they are providing beds to at a state level, the waiting lists aren't that long, the waiting lists aren't that big, and so they believe that there isn't. They stated that there is not an issue. When we've talked to our private providers, that's not the story we're hearing, and especially as we've talked to like our hospitals and the folks who are in, trying to operate ERs, there are huge waits for when somebody comes in and is admitted in an ER before they can actually get a placement at a psychiatric facility, actually get a bed somewhere where they can receive the right kind of treatment. And the more advanced the case is, the harder it is to get that placement. And that's really what we're hearing, is that's the lack of bed. It's the people who, with help, they can be very they can manage their disease, but without help, they are violent, they are hard to control, and they are a danger to the staff who are trying to provide them care. So these private facilities don't want to take those people, and so instead of getting them into a state facility, they're either winding up on the street where they can hurt someone or themselves, or they wind up in a jail because they have hurt someone or themselves. And that's not the place for those people. And so this is where it really seems to be that the state has dropped the ball on this issue.
Yeah, and displaced all of these people. I completely agree with you. That's very helpful to know. And I'm sure every sheriff out there is thinking about what this would mean for their jails if there was other places for these people to go. Sam, you've worked on some of that, issues in the past. What are your thoughts?
This is one of those issues that affects adults and youth alike. I mean, we saw this with juvenile justice reform. There's a bed shortage there. There's a bed shortage for adults seeking mental health care. And in addition to the physical lack of beds, I've seen over and over and heard from other stakeholders that there's not enough staff, that people, qualified personnel to seek out these positions, they're not, the rate that the government is able to pay isn't sufficient enough to attract qualified people. So Representative, have you seen that as well? Not just, lack of state funding for these facilities, but also to recruit staff?
Absolutely. So that's part of the conversation. I mean, even in the private bed space, we have a facility in Saginaw that has 100 physical beds, but they can typically only staff between 50 and 60 of them on a given day. So that is an issue. And those are things that, from the policy side, that's probably some of the lowest hanging fruit, is making the regulation around the staff and how can we get staff. Some of the easiest, I mean, we've in the health policy side of things, I serve on that committee as well. We've been doing interstate compacts, right? We're making sure that if you're licensed in other states, you're licensed in Michigan, and vice versa. If you're licensed in Michigan, you're licensed in those other states. We're looking at continuing education requirements and physician burnout and the different things that we can do to put us more in line with other states. I've asked stakeholders, and I know some of them have been really good partners in this and are working on it. It's, hey, what are 3 things that the state makes you do that don't contribute to patient care? And if you stop doing them tomorrow, it wouldn't hurt outcomes, right? Because if we're making you do these things that don't help patient care, why are we making you do them? So give me those things and let's start having the policy discussion around not doing it, so that we can get more people in the field, we can keep people in the field longer, and we can get patients, whether it's for physical health or mental health, the kind of treatment they need. So those are definitely issues that we've been seeing, is having people to actually staff the beds. And it does take money, as you mentioned. I mean, the reimbursements aren't there. And so let's have that discussion. Let's talk about the money. We're spending money having these people in our jail cells. We're spending money,
sure.
Sending police officers to homeless encampments, right? Like these are things that are happening now. So is that money better spent giving somebody the actual care that they need? Or is it better spent housing someone in a jail cell that has a mental health condition?
Exactly. Well, that kind of brings us to a similar topic, though. There's some cuts that are being proposed at the federal level, Medicaid cuts and cuts to the federal SNAP program. Have you, thought about that? I mean, either the Medicaid cuts, would that affect, or is it just more fraud and abuse? And then what about the proposed cuts to SNAP?
So on the Medicaid side, what we've been told from the federal level is that they're looking, the cuts they're looking are for fraud and abuse. instituting work requirements that haven't been at the federal level that would in turn reduce the number of people who would probably qualify. And so that would be a reduction. I know that the initial Senate budget was way underfunded on what we anticipate Medicaid needs would be. I haven't seen Chair Van Workum's budget yet, but from the conversations we've had, they're trying to make sure that our budget doesn't reflect that same cut in Medicaid benefits. It's really hard to say until something's passed, right? I mean, we had the first version of the House federal budget, and now we have the Senate working on that same budget, and it's drastically different. They're going to have to reconcile that just like we have to do at the state level. And then what's the president going to sign? So those are real issues that definitely affect a lot of our residents. And we're trying to be very cognizant of that. It makes it hard to do a state level budget when you receive all this federal funding and you don't know what's going to be there, which is part of the delay in why the House hasn't dropped all of its subcommittee budgets yet.
That makes perfect sense because you don't know what you're going to have.
We don't know what we're going to have. On the SNAP side of things, that's tough too. And there's always ideas on how to improve that process. There's always pieces that come from, policy decisions, like, are we going to allow this kind of food or that kind of food? Do we think it's better to push people into fresh fruits and vegetables, but we know those are more expensive. And so they're going to be able to get less food for the benefit that they get. Again, for what we've heard for SNAP reduction, it's been around fraud and abuse, work requirements, kind of things that were talked a lot about in the 90s under the Clinton administration with the contract with America from the House and the last time we had a balanced budget. Those were all policies that were enacted. It does put some added onus on the state to make sure that they're administering all those policies in a way that's both compassionate, lawful, and just fiscally responsible. So it's hard to know what's going to be there. We're going to do the best we can with what we have, though.
Awesome. Well, thank you. I mean, I know you're busy today doing your office hours and all that kind of stuff, and 3 wonderful kids. So I won't keep you too long. I think, Jimmy, did you have something you wanted to add?
Yes, and this is honestly just a thank you to Representative Bierlein for introducing some legislation which is going to be extending the sunset clause for maintenance of effort payments for Michigan County medical care facilities. So for the folks listening, essentially since before 1980, county medical care facilities were reimbursed at a Medicaid rate, which had a ceiling. However, most of these county medical care facilities were over that ceiling, and so ended up having to go to their county commissioners, and they'd have to ask for an allocation to cover that. Starting in 1980, the state established a maintenance of effort tax as a way just to bring in more federal money to the Medicaid system. And this reimbursement system was basically a partnership between the state, the counties, and the county medical care facilities. So this is just money that passes through the county, and it matches Medicaid dollars and directs them to the county medical care facilities. And so every 3 to 5 years, this has been extended since 1984. And luckily, we have Representative Bierlein, who's going to be leading the charge here for a 5-year extension. So, really excited. Sounded like talking with your staff that had just been introduced. So we're looking forward to seeing that go through the process. And again, just want to thank you for taking the lead on this.
Well, really happy to do it. In a lot of counties, these are kind of the jewel of the county in that space. My home one here in Tuscola County is a great facility. They have great staff, and the people there get top-notch care. So just happy to do it. Happy to be part of the solution.
Awesome. Thank you. Thank you. Any parting words? You want to make fun of Steve for not being on today?
Yeah, I would just say that Matt continues to have great people that do a really wonderful job advocating for counties, do a great job educating, and just keep up the great work. And as always, happy to help, happy to work with you on things. And if any of your commissioners out there have any questions or just even want to tour the Capitol, don't ever hesitate to reach out to my office.
You're the best. You're the best. Thank you. All right. Well, you have a wonderful 4th of July. Happy 4th of July to everybody who is listening, and we will catch up with you next week.
Thank you for listening to today's episode of Podcast 83.